Hello, I'm Dr. Prasoon. Welcome back to Dofuri. It is Mandala Puja. If you're planning to visit Sabarimala this year and if you're worried about your health, you should definitely watch this video because in this video, I'm going to tell you some health tips which will make sure that your visit to Sabarimala will be a healthy one, a safe one, even if you are taking medicines for several diseases. So let's get started. If you're suffering from chronic lifestyle diseases such as diabetes, high blood pressure, or any heart diseases, then you should definitely carry the medicines that you're taking regularly with you, and also remember to carry the prescription, the latest one, when you are visiting Sabarimala. Skipping medicines, particularly for diabetes, is not a good thing because lots of changes, variations in blood sugar and blood pressure is expected during the ascent to the Sannidhanam. At that time, what you don't want is drastic changes in your blood pressure and sugar values. So taking the medicines at the right time will help you keep those values in the normal range. Before planning the visit to Sabarimala, it is highly advisable to get the consent from your regular doctor. Plan the date of visit well in advance. If you are a person who is not working out regularly, it is going to be a bit difficult, particularly in the first 1.5 kilometers of the ascent. So I'll recommend you to do some physical activities such as brisk walking, cycling, or anything that you are comfortable doing, and start doing it at least 30 days before the planned visit. If you're a person who is taking regular medicines for diabetes, the chances of low blood sugar value to develop when you are ascending the hill is very high. So make sure that you have some sweets or fruits with you in hand. If you feel some of the warning symptoms such as dizziness, fatigue, tiredness, increased breathlessness, some of the common symptoms of low blood sugar, you can take a sweet, take some rest, and then continue the journey when you feel okay. It is also advisable to keep your blood sugar values in the normal range before making the planned visit. If you are taking insulin, please do carry it with you. Have all the proper medicines and insulin in your hand. If you are suffering from heart disease, if you had a past history of a heart attack, then you should definitely carry the tablet Sorbitrate in your pocket. If you're feeling chest pain during the ascent, particularly in the first kilometer, which is the steepest one, then you should stop your journey, take rest, use the tablets, and you should also make use of all the medical services provided by the government of Kerala. Cardiology centers are also available at Pampa and Apachimedu. If you're a person who is taking medicines for epilepsy or seizures, then you should definitely take the medicines with you. You should also plan the journey in such a way that you do not compromise on your sleep. If there is long queue in Sabarimala, then unplanned visits to Sabarimala can often lead to long waiting times before you get the darshan. So if you're a person who is suffering from epilepsy, please make sure that you get the darshan in the daytime itself. In some cases, your sleep might be compromised and it can happen during unplanned visits. If your sleep is compromised and you're a person who is taking medicines for epilepsy, then seizures might develop. If you're a person who is suffering from asthma, you should take your medicines, and if any inhalers have been prescribed by your doctor, you should also carry it with you to Sabarimala. You should also make use of the oxygen booths which have been set up throughout the 5-kilometer uphill journey. If you are suffering from any of these mentioned diseases, then you should keep in mind that particularly the first 2 kilometers is the most difficult and the steepest part of the journey uphill, and during that ascent you should be climbing at your lowest pace without any hurry and making sure that you get frequent and adequate rest. The second point to note is that when you are at Pampa, you should not make your stomach full, because if you make your stomach full and then start the 5-kilometer uphill journey, then certain complications can develop, including heart attacks, particularly in those patients who are vulnerable and elderly. This is because if your stomach is full, more blood flow is diverted to the stomach and intestines so that digestion of that food takes place. And during the uphill journey, more blood flow is required to other important organs such as your brain and your heart. So it is always advisable to eat very little before you start the uphill journey. If you are suffering from these chronic diseases, lifestyle diseases, and if you are an elderly person, please do not make the journey to Sabarimala all by yourself, all alone. Next point to note is that while having your meals, breakfast, or while eating any snacks or drinking any water from any restaurants, please make sure that it is clean and boiled water. The number of diarrheal diseases usually rises during the Sabarimala pilgrimage season, and this can be prevented if you keep your personal hygiene at the recommended levels. If you have any health issues or if you face any difficulties during the ascent to Sannidhanam, please make sure that you use the medical services that are being provided by the government of Kerala. Medical centers have been set up at Pampa, Neelimala, Apachimedu, and Sannidhanam. Facilities include cardiology doctors, pediatricians, orthopedicians, general medicine doctors. You can easily get your ECG done. You can easily check your blood pressure, have your blood sugar monitored, and please continue the journey only after getting the nod from the doctors posted there. If you need any help, please use the helpline that are being displayed right now. I will also leave the helpline numbers below the like button. And please remember that you can easily connect to a doctor through chat, video call, and audio call using the Dofudi app. You can download it using the link provided in the description box below. So I hope you like this video. Please do share it with all your friends and family who are visiting Sabarimala this year. I'll see you in the next one. It's me, Dr. Prasoon. Thank you so much for watching. Swami Sharnam Ayappa.